Over the last 10 years, the Feelings Program team have moved from a model of consulting with consumers to establishing the first peer researcher position in public health in New South Wales, so that a consumer is a core member of our research team.
The partnership between the Feelings Program team and autistic consumers has continued to grow and expand. This hasn't happened by accident. This is through the allyship and the advocacy of the researchers.
Our consumer partner work began by inviting previous research participants with a lived experience of autism and intellectual disability to join our team as consumer carer representatives. Their initial ad hoc role included contributing to future research ideas and resources, focus groups, and assisting with elements of the intervention. However, their role evolved into helping contribute to funding pitches and more recently co-presenting at conferences. As their role evolved, it became clear a formal peer researcher position was needed. While we began the task of developing the role and securing funding for the position, we also started our next research program, supporting the often overlooked mental health needs of adolescents with cerebral palsy. In partnership with Cerebral Palsy Alliance and CP Quest, we now partner with 11 lived experience research partners, both adults and parents from across Australia, each with paid, flexible roles that match their skills, interests, and time availability. And they're helping us to develop our research project, focus groups, and co-designing our next clinical trial.
I've always felt valued and supported, and as part of their team, my feedback has been welcomed, accommodations have been offered freely, and I have always felt safe to contribute my views as an autistic person to their research and to the program. The impact of the program has been meaningful in subtle and significant ways. I've been able to bring some practical insight into how the program will be received by autistic communities. I've been able to clarify language, challenge assumptions. It is not only evidence-based, but meets the wants and needs of the autistic community. What worked well was the flexibility and initiative of the team. So while it's grounded in best practice frameworks in co-production and co-design, there was no precedent for an autistic peer researcher in New South Wales Health. This partnership wasn't all worked out from the start, but I don't think that's the point. They had a willingness to put their trust in and funding behind lived experience, and they could see the importance of it. I think the rest we can build together.
The research that we conduct is underpinned by respect for the diverse lived and professional experiences we bring to mental health research.
Yeah, just give it a go and see how it turns out to be.
Brilliant. And has it been helpful for you?
Yes, it has.